Yes, it's the reality that we're living today, and we have been living for the past 8 or 9 months. This is a pandemic, and what we know now is the virus doesn't respect anyone, any skin color, any position, any political position, any money. It just can affect anyone. Well, I think the most important and for the public, it's not only for the White House, it's for the public to understand that once we have a positive contact, it's extremely important, and we will see it, how it should be done, which is the contact tracing. So they need to trace back from 2 days before the testing was positive or the onset of symptoms and see which persons, who has been in contact with the president, who has been in contact with the first lady, who has been in contact with Mrs. Hicks, and then trace back and then ask those people to stay in quarantine. So it's a lot of work. This is only a small group of people, but I'm pretty sure there's going to be a lot of, it is my understanding that he was in a fundraiser in New Jersey. So those people will have to be in quarantine for 14 days until they have symptoms or not. Anyone who has been exposed with the president for more than 15 minutes in the same room, any person who has been in contact with any other person who has been infected or tested positive for more than 15 minutes indoors needs to have to be in quarantine. Well, I think when he scheduled the rally, he did not have any idea about this. But right now, if he's positive, of course, that is not a great idea, and I highly doubt it that he will do it. That's common sense. I'm certain that everything, traveling and everything with when you are positive and you're 74 needs to be taken with great caution. I've been saying all along and publicly, any crowds, no matter the political party or the reason, could be a concert, could be a wedding, could be a family reunion, could be a political rally. Getting right now, when we have that many positive cases in the community, it is just not a good idea. So shouldn't apply just to political rallies, should apply to everyone. So if you have plans for this weekend and you are going to get together with more than 6 people, I ask everyone to please reconsider, because we are having high cases in the community, and in no time that will translate in more hospital admissions and eventually, unfortunately, in more deaths. Absolutely. He is the president of the United States. He's the most important person in the world, and not only the future of a nation in the midst of an election. It's at stake, but also many other things. Because of his age, 74, and because of his body, he has about 5% chances of dying because of the virus. The other side of the coin, which is the good news, is that he has 95% chances of do well, which is what happens in the majority of people. But certainly, I wouldn't like to enter in that lottery. I never would like to buy a ticket on that lottery of dying because of COVID. Absolutely. What I want to reaffirm is that every public place should adhere to protocols to prevent something like this. We should learn from this. And what we should learn is just testing just doesn't do it. What we need to do is the simple practice is very simple. Keep away 6 feet from other people. Try to stay away from people at all if you can. And if you can, stay 6 feet away. Put your mask, frequent hand washing, and if you feel ill, stay at home and get tested. That's very, very simple.
I just had a quick question or two. Could you fill us in on how quarantine works? What is allowed and not allowed when one is quarantined?
Yes. Well, the quarantine starts 14 days from the time of exposure. So if if someone, for instance, gets exposed to a person today, the quarantine starts today. But if there is ongoing contact every day, the quarantine starts from the last time there was a contact. So sometimes it's very difficult because people living in the same household, they don't realize that someone was infected until 3 or 4 days later. So for the other persons living in the same household, their quarantine starts at that time when they separate from the infected person. And that is different from isolation. Once you have the virus, because you are already symptomatic and shedding the virus, and you are in the process of either getting sicker or recovering, which is the most likely scenario, it's about 10 days. So quarantine is when you don't have the disease, you were exposed, you are waiting to see if you're going to catch the disease or not. Isolation is you know that you are positive, and you need to count 10 days from when you start with symptoms. Is about 10 days, assuming that there's no fever or other symptoms COVID related. So shorter for when you know that you have the virus, longer when you don't know that you have the virus, because unfortunately there's a latency period. It takes several days before you know if you're infected or not.
So you kind of explained this pretty well, but what are you allowed to do or not allowed to do when you are quarantined?
When you are quarantined, you need to stay at home, and then you are not allowed to go outside. You are not allowed to go to places. You're not gonna go to allowed to go to your haircut or anything. It's just staying in your house indoors, ideally inside your room, and only going to your bathroom. If you go out and you live in the same household with other people, wearing a mask and washing your hands and disinfecting surfaces, it is so at a household that can be challenging, trying to prevent people away from others, particularly in the small quarters like an apartment, for instance. So it's essentially stay at home and don't get out. You cannot go places. That's the real quarantine.
And then you got into this a little bit, but once you test positive or you find out that you are positive, what steps do you need to take when you're in that situation and you find out you have a positive result?
Well, first, do not panic, because again, the majority of people will do extremely well. Of course, there's that 10% of people who will develop more severe symptoms and eventually end up in the hospital. Those are the ones that we have to pay attention. So number one, checking your temperature twice a day. It is very important. Number two, any symptom that is worsening, could be a headache, could be shortness of breath, could be a cough, needs to be brought to the attention to the doctor or whoever is your provider. And if you have symptoms like shortness of breath, if you have access to a pulse oximeter, which is a little device that will measure your oxygen levels, it is good. Not everyone can afford it, but they are not that expensive, and that will provide you with a measurement of your oxygen levels. And if your oxygen levels are below 90%, certainly it's time to go to the emergency room or to the hospital, because chances are that you will need more care.